Bismillahirrahmanirrahim. Today we are going to start a new series of online lectures, and in this part of our lectures we will study disorders of the musculoskeletal system. In disorders of the musculoskeletal system, we will study diseases of the bones and cartilage. We will study diseases of the joints, and then we will study the diseases of the soft tissue. Before we start to discuss the diseases of the bones, it is important to know the basic structure of the bone and the process of the bone remodeling. Bone is not an inert structure, and it undergoes a continuous process of bone remodeling in which the old bone is replaced by the new bone. Bone resorption, in which the old bone is digested and dissolved by the osteoclast cells in the bone, and followed by the new bone formation by the osteoblasts. We know that the bone is a type of connective tissue, and it is a mineralized connective tissue. By mineralized connective tissue, we mean that the minerals like calcium and phosphate are deposited on a proteinaceous matrix, and for this reason we divide bone into an organic component which makes about 35% of the bone structure and an inorganic component which makes about 65% of the bone structure. The organic component is mainly the osteoid and the bone cells. The osteoid, which is secreted by the type of cells known as the osteoblasts, mainly consists of collagen and mucopolysaccharide gel. The collagen in bone is of the collagen type 1. The second part of the organic component are the bone cells. The three important bone cells are the osteoblasts and osteocytes. Osteoblasts are the bone forming cells, and they secrete the osteoid type 1 collagen, and some of the osteoblasts, they get trapped in the newly formed osteoid seam, and they are the inactive osteoblasts known as the osteocytes. However, the osteocytes have other important functions of communication between various types of the bone cells. The second type of bone cells are known as the osteoclasts, which are derived from a type of monocyte macrophage system, and they are modified macrophages, and these multinucleated cells, they are involved in bone resorption, and these are the bone digesting cells. Now coming to the inorganic component, which makes about 65% of the bone structure, and this is the mineralized part of the bone structure, and it mainly consists of the hydroxyapatite. And the hydroxyapatite is the structure which mainly contains calcium and phosphate. In addition to the calcium and phosphate as bone minerals, we know that the total calcium, body calcium, 95%, 99% is stored in the bones, while 85% of the total body phosphorus or phosphate is stored in the bones. Additionally, 65% of the body sodium and magnesium are also stored in the bones. So the various functions that are assigned to the bone, for example, the movements, attachment of the tendons, muscles, and structure protection that the bone gives to the various visceral structures in the body, they are also the source of these minerals, particularly the calcium. Now, as we know that the bone is not an inert structure, and initially it may appear as an inert structure, but actually it is a dynamic structure, and it undergoes continuous replacement in which old bone is resorbed and is replaced by the formation of the new bone. We know that the bone is divided into a compact or lamellar bone and the inner spongy bone or trabecular bone. So the spongy bone or trabecular bone is replaced every 4 years. The trabecular or spongy bone that was present 4 years back is completely replaced by new bone today. Talking about the lamellar bone or compact bone, it is replaced every 10 years. So the bone remodeling is the process of old bone resorption and new bone formation. And the bone remodeling serves important functions, and the three important functions of the bone remodeling include the replacement of the old bone by the new bone. It is also involved in reshaping the bone after fractures, and the bone remodeling has very important part in repairing the micro cracks, particularly in the weight bearing bones that we experience in our daily routine life. Coming to a review of the bone structure, we know that the bone, for example, a long bone like a femur is surrounded by the layer known as the periosteum, which has a fibrous and inner cellular layer. The inner medullary canal, which contains the spongy bone, and in its center it contains the bone marrow. It is surrounded by another layer known as the endosteum. The functional unit of the lamellar bone is the osteon, and these osteon are pillar-like structures, and they have a central canal which known as the Haversian canal, which contains blood vessels and nerves. The lamella or the lamellar part of the bone, as we said, is composed of in the organic part, which contains the collagen and mucopolysaccharides, and the collagen is of type 1 collagen, and it also contains the hydroxyapatite, which is the inorganic part and mainly consists of calcium phosphate and other minerals. The medullary canal, which is surrounded by the endosteum as compared to the periosteum, which surrounds the whole bone, contains the spongy or cancellous bone. And in the center it contains the bone marrow, and the bone marrow is the site where blood cells are produced. The outer hard lamellar bone is known as the cortical bone, and the inner bone, which consists of trabeculi, which are class-linking rods, is the spongy bone, and these trabeculi, which are rod-like structures, they provide resistance to the mechanical stress, particularly in the weight-bearing bones. We know that we divide a long bone like the femur into different portions. The epiphysis, this region is the metaphysis, which contains the growth plates of the bone, and in children these growth plates continually lay down bone, but in adults these metaphysis, they close, forming the epiphyseal closure, and there is no longitudinal growth of the long bone. The central portion is the diaphysis, which contains the bone marrow, and it is important to say that the bone marrow is also contained in the spongy bone, in the spaces in between the trabeculi of the spongy bones. At the articular ends, there is no periosteum. And these are the sites where the bones articulate to each other, forming the joints. Now, microscopically, we can identify bone remodeling by the cells osteoblasts that synthesize the osteoid seam, or the bone matrix, which is made up of collagen, type 1 collagen, and mucopolysaccharides, and these are secreted by the osteoblasts, and this is the site where later on calcium and phosphate will be deposited and the bone will become mineralized. The second type of important cells are the osteoclasts, and in this microscopic picture we can see two multinucleated osteoclasts that continue to resorb bone. Some of the osteoblasts, they get trapped in the lamellar bone and lie in the sites known as the lacunae. And in this picture we can see the osteoblasts that has got converted into osteocytes and are trapped in the lacunae in the lamellar bone. The outer layer of the bone known as the periosteum, and as I said that this periosteum is absent at the articular ends of the bone where the bones articulate with each other to form joints. And this periosteum protects bones, and it also provides attachments for the ligaments and tendons. The periosteum is divided into an outer fibrous layer and an inner cellular layer which contains the progenitor stem cells, mainly the osteoblasts that secrete bone matrix and the chondroblasts that produce cartilage. The bone marrow is the part that lies in the center of the medullary cavity and also in the spaces between the trabeculi in the spongy bone. They are involved in the production of cells. Initially, there is a single cell known as the hematopoietic stem cell, and all the cells of the blood and immune systems are derived by the differentiation of this hematopoietic stem cell. At the beginning, this hematopoietic stem cells differentiate into two types of cells. One is known as the myeloid progenitor cell and the other is known as the lymphoid progenitor cells. The myeloid progenitor cell will differentiate into a number of cells including red blood cells, megakaryocytes, which will lead to the production of the platelets, and the myeloblasts. The myeloblast contains the neutrophils, and we know that neutrophils are very important, particularly in acute inflammation, and they are phagocytic cells. Additionally, the basophils are produced, which are involved in blood clotting and have other functions. The eosinophils, which have spectacle-shaped nucleus and eosinophilic cytoplasm, and they are involved in parasitic infections and hypersensitivity reactions. The monocyte is the very important cell. Usually it circulates in the blood, but when it is transferred into the tissue, it becomes a powerful cell known as the macrophage. And the macrophage has got many functions, and a type of monocytes, they will differentiate into the osteoclasts, which are the cells that are involved in bone resorption. The lymphoid progenitor cell will give rise to the cells that take part in the adaptive immunity, particularly the T lymphocytes and the B lymphocytes that differentiate into plasma cells and produce antibodies, and the T lymphocytes that are involved in the cell-mediated immune reactions. Now, bone remodeling is the result, and it is the balance between the bone formation and bone resorption. And there are many diseases in which either there is excessive bone formation, for example, that is seen in Paget disease, and sometimes there will be excessive bone resorption that is commonly seen in the disease known as the osteoporosis. However, this balance of the bone formation by the osteoblasts and bone resorption by the osteoclasts depends on the serum calcium level. And the serum calcium level is controlled by certain hormones, and these are the extrinsic factors that control the calcium homeostasis in the blood. And they include the parathyroid hormone, which is secreted by the parathyroid glands, which are 4 glands at the posterior surface of the thyroid gland, and they secrete the parathyroid hormone, and the parathyroid hormone will stimulate the demineralization of the bone, removal of the calcium from the bone. And the parathyroid hormone also cause hypercalcemia by increasing the reabsorption of calcium from the renal tubules and by increasing the excretion of phosphate. Calcitonin is another hormone which is secreted by the parafollicular cells or C cells in the thyroid gland, and they do exactly opposite the parathyroid hormone. They will increase bone mineralization, and for this purpose, in certain conditions in which there is excess bone resorption, the calcitonin can be used as a medication. We know that the vitamin D, and particularly the active vitamin D3 or calcitriol, it is produced by the kidney under the effect of the parathyroid hormone, and this active vitamin D3 is involved, and it increases the absorption of calcium from the gastrointestinal tract. So overall, these factors will affect the serum calcium level, and the serum calcium level then affects the bone formation or bone resorption. And as we know that the trabecular or spongy bone is replaced every 3 to 4 years, while the compact or cortical bone is replaced every 10 years. This slide is very important, and this is the molecular level at which the bone cells interact with each other by causing either bone formation or bone resorption. The osteoblasts are the cells which are derived from the progenitor osteoblast cells, and the osteoblasts, they secrete two important factors that are involved in the activation of the osteoclasts. The rank lesion, the receptor activator of the nuclear factor kappa B, and secreted by the osteoblast, it will bind to the rank receptor on the osteoclast, and at the same time the macrophage colony stimulating factor will bind to the receptor on the osteoclast, or the type of the macrophages that develop into the osteoclast, and these two factors, it will activate, and it will cause differentiation of the precursor osteoclast into mature osteoclast. And this mature osteoclast will then secrete the enzymes, hydrolytic enzymes like the collagenase and hydrochloric acid. The collagenase will dissolve the collagen, and the hydrochloric acid will dissolve the minerals hydroxyapatite. And in this way, the osteoclasts, they cause breakdown of the bone known as the bone resorption. Now, after some time of bone resorptions, the osteoblasts secrete another inhibitory factor, which is known as the osteoprotegerine. This osteoprotegerine is the inhibitory factor, and it will bind to the rank lesion and will inactivate it, thus stopping the process of the osteoclastic resorption of the bone. Now, when some bone is resorbed, after a period of bone resorption, the osteoprotegerine is secreted by the osteoblast, and it will stop the osteoclast from causing breakdown. We know that the osteoblasts, in response to the certain extrinsic factors that we discussed in the previous slide, like vitamin D3, parathyroid hormone, and calcitonin, that maintain the calcium level or calcium homeostasis in the blood, they will stimulate the osteoblast to secrete the osteoid seam. The osteoid seam mainly contains type 1 collagen and mucopolysaccharides. Later on, in this osteoid seam, the calcium and phosphate minerals are deposited. And this is known as the mineralization of the osteoid seam. And this will give rise to the formation of the new bone. This the histological picture, and here we can see the osteoblast and the osteoid matrix, and here we can see the osteoclast and cortical or lamellar bone with the osteocytes that have get trapped in the lacunae. And as I told, that these osteocytes are those osteoblasts that get trapped in the osteoid secreted by the osteoblast, and later on when mineralization occur, they come to lie in the spaces known as the lacunae, and they have got important functions. Though at this stage they are not secreting the osteoid matrix, but here its functions are in the form of intercommunication between various bone cells. Now, the bone remodeling is affected by local factors and external factors. The local factors include the local talks between the osteoblast and osteoclast, and that we discussed in the previous slide in the form of rank lesion, osteoprotegerine, and macrophage colony stimulating factor. The alkaline phosphatase is a very important enzyme, and by phosphatase it means that it is an enzyme that will degrade phosphate. And this alkaline phosphatase is secreted by the osteoblasts. And its important function, it has got many functions, but the very important function is that it will hydrolyze the inorganic pyrophosphate. And it is important to note that this inorganic pyrophosphate is a natural inhibitor of the mineralization, in which calcium and phosphate salts are deposited in the osteoid seam. So here we can say that alkaline phosphatase has got a very important role in bone mineralization, and we measure this alkaline phosphatase in the investigations and diagnosis of many diseases. The important external factor is the parathyroid hormone, which is secreted by the parathyroid gland in response to hypocalcemia or low calcium level, and it causes the osteoblast to release the rank lesion, which will trigger bone resorption, and it will cause hypercalcemia by releasing calcium from the bone by causing demineralization. And in conditions where there is calcium, which has very important functions in the body, when the serum calcium level falls, the parathyroid hormone cause release of calcium from the bone, and here the bones, they act as buffers for the calcium level. Calcitonin has got a little role in calcium homeostasis. However, it is secreted by the C cells or parafollicular cells of the thyroid gland, and these C cells or parafollicular cells are very important because a type of thyroid cancer known as the medullary carcinoma arises from these parafollicular cells. And normally the calcitonin has got its function exactly opposite of the parathyroid hormone, and it is released in response to hypercalcemia, and it stimulates bone mineralization and deposition of calcium in the bone. The vitamin D, which may be derived from outside, for example in the diet, or sometimes and another important source is the exposure of our skin to the sunlight, which converts cholesterol in the skin into cholecalciferol, and the cholecalciferol, which is activated first in the liver and then in the kidney by the alpha hydroxylase, and it is converted into the active form of vitamin D3 known as the calcitriol, and this calcitriol then increases the reabsorption of calcium from the gut in response to hypocalcemia, and it will also stimulate the calcitonin release from the thyroid gland, which will inhibit bone resorption and which will stimulate the deposition of minerals in the bone. Another factor on bone remodeling is the mechanical stress, and this is the reason that why people, particularly in the modern era, in the lack of exercise, they have very poor bone density, which is an optimum bone mass that is formed from 20 to 29 years, and people who do not exercise and who are not subjected to mechanical stress, they have poor mean bone mass, and the exercise and mechanical stress, particularly on the weight bearing bones, they accelerate the bone remodeling. And this stimulation of the bone remodeling by the exercise and mechanical stress, particularly on the weight bearing bone, is known as the Wolff's law. So a summary of the today's lecture is that bone remodeling is a continuous process and consists of bone resorption by the osteoclasts and bone formation by the osteoblasts. The osteoblasts, they secrete the rank lesion. Rank is the receptor activator for nuclear factor kappa B that is present in the nucleus of the osteoclasts, and also the macrophage colony stimulating factor that cause maturation and differentiation of a type of macrophage into the osteoclasts, and the osteoclasts, they will cause bone resorption, and the inhibitory factor which inhibits the rank lesion is known as the OBG or osteoprotegerin, which is also secreted by the osteoblasts. So the functions of the bone remodeling is the repairing of the tiny cracks which happen in the bones during normal activity, and also when the bones are fractured. So bone remodeling has got very important role in the healing process of the bone fractures. Thank you very much.